My name is Kelly Meloche. I'm the president of International Healthcare Providers. I've been having 2 talks at the conference. The first one was on incorporating medical travel or technology into your medical travel surgical practice. I hope I did better at it than what I just said it. And today I speak on the analysis of the Canadian patient market. Well, I'm one of the only Canadian healthcare facilitators bringing Canadian patients into the U.S. And I think it's very timely right now with Obamacare how everybody's afraid that they're getting a Canadian healthcare system in the States. So it's relevant that way. I've been in the business, one of the longest companies that have survived the recession. So I probably have a little bit of expertise. Well, education, I think, is twofold. The education should involve transparency in terms of providers educating the patients and the market as well. So they need to provide that transparency on what they're actually offering in terms of outcomes. A lot of times they just use initials or whatever. But I think the education needs to come from the select few that are hoping to gain access to a Canadian patient market or any international market. As far as certification, I think that it's a good thing because many of the industries aren't policed right now. And there does need to be some accountability and education for different people in their field on how the correct way is to conduct themselves. Unfortunately, I don't think the certifications are going to mean much to the general public right now because people are operating without certification. So what would a certification need to them? So that's the education process again. I've looked at the agenda. I've been to many meetings. The caliber of the people speaking here is phenomenal. I think that there's a great cross-section of expertise. There's an integration from all of the countries. I just left a meeting right now, and I thought it was absolutely fantastic, the dialogue that was initiated, and controversial at times, so everybody's bringing something to the table and free to debate on what's going on, but they do bring in a lot of structure, a lot of expertise, so I think that the industry has evolved, and it is now high-ranking people, high-educated people are migrating into it now. This is my first Congress that I've ever attended, and thrilled because I get to participate and speak at it twice. The best part is the interaction, the networking that's going on, because it's very quality networking and it's facilitated in a way to garner those relationships and to be pushed. So there's not a lot of time to let people just hover with the same groups of people to see who they know. They're really, really pushing to create a critical mass of thinking. So everybody, it's global, and so they're allowing that integration to happen. I think it's wonderful. Yes, we have a socialized system, which means that it's a monopoly run by the government. And right now it's controversial because they're saying that it's a violation of our rights and freedoms because we have this very long waiting list in Canada. Over 800,000 people are on a waiting list for a procedure. So with our total population, it equals 2.5% of Canadians are waiting for a healthcare procedure. They're waiting for up to 3 years for a hip or knee replacement, sometimes a year for a specialist appointment, 2 years after that. And what happens in that time, the economy suffers, both because they're not contributing to the economy, and certainly their quality of life diminishes, and other problems evoke, such as drug addiction to painkillers. So Canadians aren't accultured to purchasing their own health care, which is really interesting. We very much do what our doctors say, and we wait politely, then we go home and we're miserable about it. But right now there seems to be people have been waiting so long, and even though they've infused billions of dollars into the system, it hasn't done anything. So the patients factor has erupted, and enough Canadian patients have left the country and come back with great success. So what happens, of course, that's the ripple effect. They will go to the United States because it's familiar. They'll go to Florida because they're snowbirds, so they need that comfortability. Very, very difficult to talk a Canadian into going to Europe for healthcare because they just don't understand, and there's those cultural differences, which I think would be for Americans as well, but because Canadians, we typically don't have a say in our healthcare. When we do try to be our own champion about it, it's quite a feat for us. It's not cheap here, but Canadians have no idea what anything would cost. So most of the time what they'll do is they need a lot of hand-holding. The thought of going to Costa Rica, whatever, a lot of Canadians will think, well, why? Why is it $9,000 here? And I'm not saying that Costa Rican healthcare is bad by any means, or any, where it's cheaper, but they don't understand the dynamic of what's making it cheaper. A lot of times they just think, well, it's a lot cheaper there. Why? Am I having it done in a hut? So they have no idea. The U.S. is familiar, and the U.S. in a Canadian's mind is very, very powerful. So, you say the Mayo, and they'll think, oh, it will go right there, because Canadians or Americans just do it right.